always in the water, out sailing or biking, and being able to do that. And then with kidney failure, it just seemed like I was slowing down.
Everyone is at risk. The rejection is one of the leading cause of graft failure. Despite having very good short-term outcome in the first few years, we learned that in the long run, there are a lot more rejection that led to the graft loss.
My name is Diana Armstrong, and I am Brian Armstrong's mother, and I'm also his kidney donor. Brian was born with one kidney, but the doctors told us that it wouldn't be a problem because the other kidney would what they call hypertrophy. Some years in, I just got curious. He was having blood tests at his doctor's, and so I asked the doctor, how is his creatinine level? And when he told us, we were pretty much in shock.
It never really occurred to put two and two together. During finals, I got this doctor's note saying like, hey, a doctor called me, he's like, you're in stage 4, you need to take care of this now. I'm like, really? Now? Pretty close to getting my degree, so it really kind of bugged me. I got to get on the kidney transplant list.
I did my kidney donation. It's a voucher program. They wanted to have an appropriately younger kidney. And so the kidney exchange program allows me to donate my kidney to someone closer to my age, and then they would find a kidney, more appropriate for him.
The reason we do the test is 3 things. One is to diagnose the rejection, or to say patients are at higher risk of rejection. One of those are patients that are doing very well. Majority of our patients, maybe a quarter of them, could have injury to the kidney that we didn't know. We also do the test in patients that we do think they may have a rejection, but it's too high risk or difficult to do biopsy. And the third one that we do more routinely now is we use that to monitor the treatment response. What we learned the last several years, even though the kidney function come back to normal, it doesn't mean that the rejection, the inflammation already gone away. And the newer data we see as many as 40-50% of what we call lower grade rejection did not respond to the treatment.
The 3.5 years after my transplant, the Prospera picked up a drastic change in my chart. They showed me the graph and it was like flat, straight up, and then down. And they had doctors, wanted me to come in. They managed to get it under control. I guess in a sense, Prospera worked for me. If it worked for me, it'll help someone else out. And the fact is, I didn't know I didn't have a kidney problem, and it took 3 years for anything to show up. But it saved my kidney, and I highly recommend, taking Prospera.
People who have to wait until they actually have symptoms, usually the damage is done. Brian came out of this despite 2 weeks in the hospital. It wasn't easy. He came out of it miraculously with no damage to his kidney. I don't know how to express my thanks to the Prospera because I feel like it saved Brian's kidney.